In the first half, we were actually making losses. We are talking about water that you inhale. There needs to be certain market confidence to be able to continuously sell that. In the coming months, we are going to step foot into.
2024 has been wow for Malaysian small cap index, hitting a 10-year high as we speak. It's one of the best performing markets in the region. I've wanted to dive deep into small cap stocks, but I didn't know where to start. Then I found RHB Small Cap Jewel 2024 edition, packed with all the insights I needed. Get your copy with the link in the description. After flipping through the ebook, I was hooked and I wanted more. So I'm interviewing the CEOs of these small cap companies, and here's the fun part. At the end of each episode, I will ask for a gift from the CEO and pass it on to the next guest. By the end, we'll see how much the final gift is worth. It's going to be a fun and engaging adventure as we uncover the stories behind these small cap gems. Let's see what treasures we can uncover together.
Hey Frankie, how's the breakfast in Penang?
Very good.
Since we are in Penang, let's not waste our trip. So here's 2 surprises that I've prepared for you.
Oh, got tricked or not? Choose anyone, right?
Yeah, just choose anyone.
I chose this one. Prize gift for me to do in Penang, huh? It's another video shoot. Maybe you all expect me to go and visit another tech company. Let's do it a bit differently this time. Let's go and visit a medical device company. Why this is interesting is because the company is also recently went to IPO and raised some funds for expansion. Right after the expansion is completed, immediately they have no more capacity again. They need to expand one more round. So sounds like it's good business for them, right? So I want to take this opportunity to go and visit them to see what's so interesting about their medical device. Hey, you guys, breakfast time, stop shooting lah. Come down and eat. Come down and eat. I go and get more food first, okay? Yes. So the guys tricked me to come to another video shoot. We are here at UMedic Healthcare. I'm particularly excited about this episode because this is the first time FAQ show has a female guest. Without further ado, let's go and meet Ng Zihui, the alternate director to UMedic Berhad. Hey, hello. Ooh, what is this? This is Zihui, the alternate director of UMedic.
Let's go to the showroom. I will show you some of our products.
Okay, let's start there first and then we'll have a chat later. So these are all your distribution products. Philips, I can see Philips.
Philips are one of the world's best global brand for medical device. So we are very proud of their distributor because we distribute their products for more than 10 years, almost 15 years. So basically, Philips would just be the manufacturer. They manufacture and we do the sales, we do the clinical training, we do the after sales. So we have a full range of services to provide to our customers. You know, in medical device industry, you are not just talking about sales. You know, this kind of product, if it breaks down, it's talking about life and death. So we have our biomedical engineers that will be there on call. If we ever have any breakdown, we will be there to help them.
People who are working in a hospital, they are all experts, right?
Correct.
They would know how to operate such devices, right? So is there really a need to really provide this kind of
Not
service?
necessarily,
Serious?
especially, you know, we are in this high-tech advanced technology. If we are talking about some of our distributed devices, like from Philips and GE and Myray and a lot others, it needs our clinical application team to go and do training for them. Because every devices are different, it depends on the specification.
So it's not like any Tom, Dick and Harry can become a sales rep of the company
No,
also, right? Because
yes,
the way you said it's like so highly technical.
Our portfolio is more on the high-value product. So sales team will have to go through those training with our principal and take the assessment. Once they've done that, only they are able to sell it. Otherwise, you won't able to speak to the doctors, you won't be able to speak to the nurses.
You will look stupid, right?
Yeah. So this is a Myray ventilators.
So if the compliance is good, means the patient is coping well with the machine.
Right.
Okay.
So the nurse can just follow instruction here and
Yes.
go.
Yes.
This is one of the products that you distribute.
Correct.
But more interestingly is that the keyword here is ventilation, and you do a lot of consumable manufacturing
Correct.
for ventilation
That's the
also,
point.
right? Where are your manufactured stuff be put into the
so
machine?
we do for our manufacturing, so we do solution based. In fact, some of our products which is upcoming, we call it Flexi Drops, sterile water for inhalation. It can be used together with ventilator. So those will be used together, so you can see the synergy that we have with our distributed product from our principal and our own manufacturer consumables.
Interesting. You distribute other people's product, but you put in your own support
Consumables.
consumables inside, and
Yes.
then you can provide a full solution to your customers.
Correct, yes. In our company, if you want to sell ultrasound, you also need to have sonographer, the one that scan
Right.
babies and all that. We would invite those kind of doctors who are expert in this area to use our product and teach them how to use it.
These are the things that can do 3D scans also, right?
Yes, in fact it's 6D.
6D?
Yes.
What is 6D?
They will have the feature, all the baby feature. In fact, Philips is one of the best in ultrasound. Philips, they invest a lot in our technology, and we are always one of the few, the first in Malaysia to take in this kind of technology.
All these Philips, GE, Myray and all that, I'm sure they have the capabilities to come to Malaysia themselves. Why do they need a middle person like UMedic like that?
In this medical device industry, whenever you are a manufacturer, you don't necessarily want to be the distributor because you don't know the local requirements, you don't have direct access to the hospital,
I see.
and you need a lot of people who really understand the local needs to be able to distribute this product to the local people. In fact, we have a sales team all over Malaysia. We cover all area, even to Sabah and Sarawak. So we are able to access to all the hospital.
Is it a very domestic business for your kind of business?
For distribution, we are, for now, mainly is Malaysia based. However, we are looking into other Southeast Asian country to expand. In terms of our manufacturing segment, it works a little bit different. We distribute our product to distributors. So the distributor in the local market will distribute our manufacturing products. When you're a manufacturer, you want to distribute your product to other countries, you will need distributor there because distributor are those people who have direct access to the hospital, to the people who are actually using it, and they will have the deep understanding what they need. What you would see in the market, yes, a lot of people are manufacturer but not distributor, but the beauty is we are both. Yeah.
Are there any other companies like UMedic, like they are also a distributor and they are manufacturer at the same time?
I would say in the market, not
Very
a lot,
few,
very few, yeah.
Okay, before I start, Zihui, I have something for you, but it's not from me, it's from the previous guests that I interviewed. I have no idea what it is, so if you want, you can open it now, then we discover it together.
Sure, let's discover it together. So who is this from?
It's from YBS International.
Okay.
They're going into batteries, so probably that's something that you can explore together with him as well.
In fact, yes. So right now my team, we are doing some research and development on new electronic medical device, but that's something that I will disclose next time. Yeah.
All right. Wow.
Okay. So it's a shirt from YBS International.
This one money can't buy. Money can't buy shirt.
Yes. And a pen from
And a pen.
Yes.
Yeah. Sure. Okay, then I think let's put this away lah. Thanks for showing us your showroom just now. See a lot of products that you distribute and all those stuff, right? But you also have your own manufacturer side of things. These are all your products.
Correct,
right?
yes.
Since you are so experienced in distributing medical devices, why did you specifically choose to go into this kind of inhaler and humidifier?
Actually, 10 years ago, we got into contact with this kind of products, and we realized that a lot of them are using the reusable type of humidifier. So humidifier is used whenever oxygen therapy is used because oxygens that come from oxygen tank, it's dry. So if you inhale directly, it would hurt your inner lining of lung. Then we found this, it's prefilled. Prefilled meaning it's one-time use, and after you use it, you can dispose. And we realized that there is a gap in this market because we were actually bringing it from the Western world. It took a long time for us to bring it in. There's a problem with lead time and all that, and we realized there is a little bit of specification that is not in line with the local market. So we started doing our own research and development. We started, in fact, this product of ours, we have our own patented design. And that's how we started with this prefilled humidifier. Then we move on into this year, we have this new product, which is syrup water for inhalation.
This is just water, right, basically?
It's yes, it's water, but
Right.
it's purified water. There's a lot of range of in the pharmaceutical grade. So we have purified water. We are working on water for inhalation, which is upcoming in this product.
Just now you said you patented the design of your product, but from what I can see, it doesn't look very different from any other medical devices that I see in hospital. So maybe you can share with us what is the thing that you patented.
So for this one, in fact, we won one of the Best Innovation Award under one of the government programs, and we have one-way inhalation valve. So two-way inhalation valve. So basically, when you inhale, it will ensure that you get the medication. So medication will be put here, get the medication without anything outside going in. And then when you exhale, it will make sure that it goes in. So basically, this structure is something that we got patented. And then the other would be this. So basically, this, when you open this hose bulb, this button, you will be able to close it. So this is something that we are able to offer for our clients. So you can open it. So you just twist it.
Twist.
Yes. Yes.
Oh,
yeah.
okay.
In fact, yes. So then, yes.
Did they just spoil it?
No. This is how you use it. You just dispose it, and then you put in the oxygen tube. And we have a button cover which is here. We can cover it with this. There's a lot of other things that that makes us quite different from other manufacturers. For example, it's very detailed, like this kind of molded expiry date and manufacturing date.
Okay,
Yes, people. Actually, it's not easy to do this because
because you need the different mold for every batch.
Correct, yes.
It's quite expensive to do that, right?
Yes, it is. But we
Okay.
have chosen to do it because we want to ensure we have high quality. So basically, a lot of people can just, you can just have it printed and all that. Although there's a cost involved in doing this, not even just money, also some time cost. Because this, you have to remove your mold every batch you do. And then you have to put in another number. Tiny details that we have ensured. For example, we've chosen material that is more clear. So clear meaning they can see straight away, how much the water, instead of the material which is a little bit, I would say, opaque.
How come 10 years ago we never heard about this product and then suddenly it become a hit thing in Malaysia?
As I said, 10 years ago, a lot of people are still using the reusable one. And reusable type is very cumbersome in washing, ensuring the sanitization of the product. All that is very cumbersome and it takes a lot of time of the nurses and the practitioner. When we brought this in, we introduced how they can save time, save cost, and most importantly, ensure there's no cross-contamination, ensure there's no infection, no sharing, and ensure it is hygienic. So that's how it became popular.
My suspicion here is that it's because of COVID-19 pandemic and everything needs to be fast. So therefore, people think that, this is a good alternative. Once they go this, they never go back.
Well, you're right. To give you a flavor how medical device industry is, first, the barrier at entry, you will need to register all your product. And before you are able to register what you manufacture, we are talking about Class 2A here, we will need to make sure that all our manufacturing process is validated and is in compliance with the standard first. Only we are able to register, and every country that we export have their own set of rules. So it takes a lot of time to enter into each country, especially at the start when we are still, young in the market. It takes quite a while to enter into the market, and now that we are 10 years in, we are reaping the effect of us, having the familiarity into entering, accessing into new markets, and that's how we start, doing this.
So Carex told me that there's different classification of medical products.
Correct.
With Class 1, 2A, 2B, and then 3.
3, correct.
For their product, Class 2B products, it took them about 2 to 3 years to get the registration done. So I suppose yours is 2A, which is not so stringent compared to Carex. So how long did it take?
For every country, it differs.
Okay.
I think it would be around 2 years.
2 years.
Yes.
Okay.
But when you get to a point where you are familiar with how it works, it takes shorter time. So that's why we also work with each country. We export to more than 30 countries. With each country, we have our own distributor there, local distributor there. So we will work together with them to get the local certification. But ourselves, our product, like for example, we are ISO 13485 certified, we are 9001, that's the basic, and we are CE certified, which is the equivalent of FDA in the US. So CE mark is very important for us to penetrate into European market. And we also have halal certification. Is it necessary? No, but we do it because we want to ensure security for our Muslim users. We are also in the Middle East market and also in Malaysia.
RHB decided to put the company into its 2024 small cap jewel. You recently did an IPO for the company. Part of the proceeds from the IPO is used to do expansion of this product, but very quickly all the capacity has been filled up and now you are talking about the next phase of expansion again. Can you share with us how much you spent for the first phase of expansion and then what do you plan to do going forward?
Pre-IPO, we were only, I would say, our production capacity of let's just talk about the main product. We are only producing around 200,000 to 250,000 bottles per month, but post-IPO we started ramping up to 300,000 bottles per month, and right now we are achieving around 450,000 bottles per month. We have plans to use the proceeds to expand, to get new machineries in. In fact, we just built our factory just behind where you currently are right now to cater into expansion of this product. And by the end of this year, we are aiming to get to at least double the capacity that we have
From now?
Around 600,000.
600,000,
yes.
okay.
We are not just looking at capacity of this single product, we are looking into new product expansion. We want to expand our manufacturing portfolio, We launched this around COVID time and we started commercialize this during around our IPO time. And then earlier this year, we launched this sterile water for inhalation bag. You can see we are continuously doing a lot of research and development into expanding our product portfolio. Wow, because we have quite overwhelming demand for this humidifier, so we'll continue to expand the production capacity for this product.
This product is selling like hotcakes in Malaysia. I'm pretty sure there are other manufacturing companies see this and they thought, hey, all I need is another 2 to 3 years. I can copy this and then I can do the same thing. So the point I want to make is that with your aggressive expansion plan, do you think that if there's a new player coming into the market, it is going to be a head-on competition for you?
In the first half, we were actually making losses. We had our trading, marketing and distribution side that fund our manufacturing segment. In the first half, it takes a long time just to register, that's one thing. Second thing, to be able to gain market confidence. We are talking about medical device. We are talking about water that you inhale. There needs to be certain market confidence and user confidence to be able to continuously sell that. So we take a lot of effort, a lot of time and cost to ensure that this product is confident amongst the user. In Malaysia, we are almost in most of the hospital. I would say more than 90% of the hospital. In fact, our main market segment for this product, 90% are all exported. Even though we are already catering to a lot of hospitals in Malaysia, there's still it's still a very small portion of our
So the potential is actually very big, and by doing 600,000 bottles a month, it is still just a drop in the ocean.
I hope that continues. That's why we are continuously looking beyond just 600,000 and limiting us there and stop there. We are looking really beyond that.
Just now you mentioned about the distribution business being the core and then it supported your manufacturing side of things. If I'm not mistaken, the government is talking about from acquisition of devices into renting devices.
Yes.
Yeah. So if that's the case, then you're not able to sell anymore.
What government is doing, they are basically doing from capex to move to OPEX.
Yes, correct.
This is actually for us, it's an advantage for us.
Really?
Because we have very strong financial background, so we are able to purchase those products, make it into rent, higher purchase kind of model. A lot of smaller companies actually find it quite difficult.
So how long would it take for you to break even if you move into the rent model?
It really depends on the
device.
Products, the medical device. So we recently acquired one of lab distribution business. This kind of product, we are actually going with this kind of model because it's very expensive. So it will take, I would say, 1 to 2 years, but we are still able to gain from the consumables because they will have to buy our consumables to use the laboratory product.
It's a complementary, but 1 or 2 years is a it's a very short time for you to break even because they have a lifespan of at least 5 to 8 years, right?
Yes.
So the remaining 6 years
Yes.
is pure profit
We
for you.
are okay with this program actually, yes.
I can see very big potential in the company. I mean, Malaysia is building more hospitals, and as we age, you know, we are going into an aging population country, and more people need healthcare and stuff like that. But I have this feeling that because the growth of the market is so fast, and you are still a small cap company, there is a missing gap for you to catch up with the growth. What could this missing puzzle be in your opinion, and how would you overcome this challenge?
I think as you mentioned just now, we are really on also almost like full capacity. Our team are all working really hard into the first phase, which is the first project, which is the expansion of the factory. Not only that, we are looking already beyond our factory, how we can expand our product. We are working really hard into ensuring our quality while at the same time providing a very competitive price range for our clients. So this will make sure that we remain competitive, firstly. And then second thing, I think our manufacturing, we are always looking into like complementary product like inhaler spacer. So this product would basically support our right group of distributor, because those distributors that distribute our products, they are usually quite focused, just like us, they're quite focused on respiratory. So then they will be able to market them to their local markets.
Okay, so can I say that in order to grow further, you would need to bring in different kinds of medical devices from the principals, and then you can develop your consumables for all these devices so that you can continue to grow to become a bigger company.
Yes, and in fact, I think that's the first thing. We always look into our product portfolio expansion, as well as the segment that we are in. In the coming months, we are going to step foot into the medical service industry.
Medical service,
Yes.
what's that?
We are going to have a care center and also ambulance service. So that's a new thing that we are stepping our foot into. And this
Totally new and totally different skill set.
It's actually, we find a lot of synergy in this because as you know, we can just get a lot of our supply from our marketing and distribution for medical device, and we can directly bring that into our care center. It's the same like us bringing it into a hospital.
Last but not least, can I ask something from UMedic or maybe from yourself so that I can pass it on to the next guest?
So this is
nice.
the gift.
Right, a tote bag. And inside the tote bag we have...
As the plate that have our company, you can show it.
Can't really show it, but maybe next time we can show it.
Yes.
And also we have some sanitizer,
Yes.
from UMedic, UW Healthcare.
Correct.
Right, cool. Our next guest is going to be very sanitized. All right, thanks for your time, Zihui. I have a great chat with you, and all the best with all the ventures that you're going into, and hope to see you again.
See you again.
All right,
Thank
see
you for
soon.
coming.
Thank you.